Not enough mental health care is provided to victims or survivors of sexual violence. This is according to Doctors Without Borders. Now it's holding the Sexual Violence Research Initiative Conference in Cape Town, where its findings will be presented. Well, to discuss this, we're joined by Bori Lagrange from Doctors Without Borders. Bori, good evening. And thanks for your time. It's a very worrying story indeed. So before we actually get into what you found, can you give us some idea as to what you're seeing survivors of sexual violence actually go through?
So I think we're all aware of the national level at which sexual and gender-based violence is a very topical issue because it happens in nearly all homes, in all neighborhoods, in all townships. But our experience has been working particularly in the Bojanala district in the northwest, which is just outside of Rustenburg, which is an area on the urban periphery where many people work in the mining sector, but then also many young women are also living in those communities where they're very often the victims, the survivors of sexual and gender-based violence. And that's where our services are delivered. So we support 4 of these, they're called Khomotso Care Centers, which essentially are one-stop shops where survivors can get access to medical care, which they urgently need, but also to psychological supports for the process of recovery afterwards. So that's where we work and what we see. So in 2015, we were able to do a survey within that community, finding that at least 1 in 4 women had experienced sexual violence in her lifetime. So this equates roughly to, if you were to extrapolate those statistics, to roughly about 11,000 women in that community, in the greater Rustenburg area, surviving rape annually. So it's a massive problem, even if you bring it down to just a area outside a moderate-sized city like Rustenburg.
So your findings focus on mental health gaps for these victims or survivors of sexual violence. I mean, that is not your first thought, funny enough, when you talk about victims or survivors of such violence. You think medical first, you think about reporting the crime, and which we know that we are falling far behind on anyway. So tell us about your findings on mental health and why that part is so important to the bigger picture.
Exactly. I think what we need to do is describe the situation really as if you're a survivor of sexual and gender-based violence, it's almost as if you're entering a lottery or undertaking a massive obstacle course in order to get the care that you need to help you in the immediate term, because our view is that sexual and gender-based violence is not seen as a medical emergency. It's largely viewed through the lens of a judicial medical perspective. So as you mentioned, we're fixated on the law enforcement capacity of it, rather than assisting in the first instance the survivor to get the appropriate level of medical care to prevent the transmission of sexually transmitted infections. Mostly what we're talking about also here is if we look at South Africa with such a high rate of HIV within our communities, it's important that we put people on post-exposure prophylaxis to avoid that. So when we look at the total scope of it, mental health care is really seen at the very far end. And what our study then found in assessing the extent to which services are available is that only 20, or rather 1 in 5 facilities actually don't offer even the minimum level of trauma counseling to people should they reach that facility. In addition to that, 45% don't offer any counseling for children, which is, I think that was, for me personally, when colleagues brought out these findings, for me that was personally one of the most shocking elements of it. And then another component of it is that almost 40% don't actually do any risk assessment of suicidality, which is essential to figure out what the state of mind of the survivor is. And it's a particularly dark moment for a person once they've plucked up enough courage to reach out for assistance, and then not to even offer an assessment in terms of the danger that they may pose to themselves is, in our view, an indication of how inadequate services are.
Or what they will actually go through were a case to go to court, or were the perpetrator to be caught or their attacker be caught. So what are these women actually going through as a result of this? What is happening in those areas? Are we seeing high suicide rates? What are we seeing happening because they don't get the support?
I think the most visible element that we're seeing is high levels of stigma. So people find it incredibly difficult to come forward. What we know from our previous research in this community as well is that there are very few survivors who actually see the need to get medical care. So again, it's when we get to how the problem is understood and what is needed. And on top of that, they actually should be getting medical care, and then psychological care is even further down the line for them. When we talk about these barriers that exist, I think it's also really important that we speak about the peculiarity of what we do in that particular area. So all our staff are trained as first responders, to provide psychological first aid in a way, but also to link people that come to us to a referral chain. So what that means is even the drivers that work for us, who get a phone call from a survivor, they go and pick them up at their home. They try and calm them down. They bring them to the facility, the Khomotso Care Center, where they're then able to access a range of services. And then also there's a recommendation that they will follow up within a week after their first contact with the survivor in order to link them again to psychological care. Now, this is important. We understand that as an independent organization, we're able to offer that and to try and plug these gaps. But what we really think is super important is ultimately for health authorities to start understanding the severity and the acuteness of the problem.
And get in there and solve these.
Yeah,
and
exactly.
be part of the solution. All right, well, thanks very much. So this continues until Friday. So I'll be very interested to see what else comes out of your findings. Thank you very much, Boril Khanj from Doctors Without Borders, just talking to us about the lack of support in terms of mental health for survivors of sexual violence.